I understand it's not just spike that's being produced. There's
Yes.
other elements, right?
And this was a very good study, and it may have come from BioNTech's own paper, where they took cell culture, transfected it with the injection, and then once that cell culture starts producing the proteins that it's supposed to make, then you separate those out to say, are these cells making the target protein we want? Are they making the spike protein? And so it's supposed to weigh about 141 kilodaltons. And so we put a little electrical field on a little gel, and these proteins migrate, and then they stop according to their weight and electrical charge. And it was fascinating to look at that study and go, wait, we have 100 kilodalton weight proteins and 190, but nothing at 141 that would be a spike protein. So my concern scientifically is these products are making the body make unknown proteins as well, to the which we could be having these autoimmune responses. And if you look at the vial purity, the purity of the mRNA in the vials, you know, if you take a drug, you want to know, if I go buy an aspirin, it's actually aspirin I'm taking. I don't want half of it to be aspirin and half of it to be laced with some other production side product that may be harmful. We know microRNAs are a known carcinogen. There's medical literature showing how sequences of mRNA can either be helpful in the body, natural ones, or can be extremely harmful. And certain types of cancers, you see increased circulating microRNAs in these patients. And so to know that there are these unknown, fragmented parts of mRNA in these vials is also poor manufacturing, one, but two, medically dangerous, and three, we don't know what all those things can be causing. I mean, the panoply of side effects that we're seeing in injured patients are numerous. And these are just, you know, tip of the iceberg reasons why these things could be happening. So yeah, these are impure manufactured products, and other proteins could be causing the harm, not just spike protein.
One of the things we've discussed in the past is you were observing an uptick in certain rare cancers, also like lymphomas and things that are more common things like that. You were noticing some kind of a bacterium that was, you know, only in childhood that was now appearing in adults. You were wondering about that. I guess, has the literature around that, if the studies progressed anywhere? What do we know now? What are we seeing?
So I'm not the only one making the claim anymore, which is comforting. Many pathologists around the world are seeing it. As you know, my colleagues in Europe have pointed it out. As I travel the world and give lectures and whatnot, I've had so many doctors, like I said last time, approach me, gosh, I'm seeing this in my population. Oncologist in England that I was talking to a couple months ago, lymphomas, myelomas, leukemias, at rates he's never seen in his 40 years of practice. I was on the phone last week with an oncologist here in Texas, where we are right now, and he, you know, same thing. He has patients, he's had cancer-free, their markers are all down, they've been cancer-free for 1, 2, 5, 10, 17, 20 years in some of these patients, and after they're shot, second, third, fourth, cancer's back like wildfire. And that goes to all these immune suppression mechanisms that are multitudinous, and it's trackable now in the CDC data. So there's one researcher has a great Substack, The Ethical Skeptic, and you can see how he shows the manipulation by the CDC of their data sets. But if you do the pull forward data and look at what we call variation above trend, in the lymphomas we're seeing, you know, about a 4 sigma increase.
And what does that mean exactly, a 4 sigma?
So if I have 100 patients that get lymphoma out of, you know, say 100,000 every year, now I'm seeing, you know, maybe 105 patients. So, you know, it's that subtle change, but it's a statistically significant change. And then what you do is say, wait, this month it was 4 above the 100, now it's 5 above 100, now it's 12 above the 100. So you're seeing, you know, the trend should be this historically, and what you're watching is the trend doing this. And so if you read some of the breakdowns of his data sets in some of the solid tissue tumor cancers ages 0 to 54, now what we're seeing is a 12 sigma increase. And so these are are massive amounts compared to, statistical analysis year over year over
The
year.
baseline, basically.
The baseline, yeah. And you would expect, okay, there's going to be some of that from people missing oncology screenings during the pandemic. I appreciate that argument. A degree of that is going to be true. But then look at the population 0 to 54, where the cancer rate is very low to start with. All of a sudden, why are we seeing very aggressive cancers in these age cohorts? If you start looking at Bradford Hill criteria of causation and correlation, things start adding up very quickly. And across the board, you saw in the meeting today when I gave my talk, I said, raise your hand if you have a friend or a family member that after the shots ended up with a cancer. And it was astounding the number of hands that went up in that room. Is it everybody? Do I want to scare people thinking, oh, you got the shot, you're going to get cancer? No. But it's more significant statistically than it was before. And it was after the shots rolled out that this started happening for multiple immune reasons and other harm reasons.
Just in terms of raw numbers, what kind of differences are we talking about in areas that come to mind for you?
The raw numbers are going up. The percentage numbers look scarier than the raw numbers, but the trend line is consistently going up.
So you hear this term brandished about turbo cancers.
Mm-hmm.
What does that mean?
Good question. It was popularized by a colleague over in Europe in an article she wrote, and she's a breast pathologist. I've met with her at some of the national or international meetings, and in her cohort, she noticed younger women developing more aggressive cancers. And in oncology and pathology, we look at certain tumors and say, okay, they have this stage cancer, they have this grade of tumor. You know how it's going to behave over a set period of time. What's happening is these cancers we're used to seeing, their growth patterns and their behavior are completely out of character. And so this adjective that's been tacked on to cancer is describing a phenomenon that's unusual in the practice of medicine. Again, observationally across countless professionals around the world saying, wait a minute, I haven't seen cancer behave this way before. What's going on? So turbo cancer is something that wasn't there and all of a sudden it's everywhere. So it goes from being in one spot to everywhere all at once. And it happens in a manner that is timeline accelerated. A radiologist called me, this was many, many months back, and he had 2 31-year-old women that same day come into his office for scans, and they both had stage 4 breast cancer after their 3rd shot. And so these are the type of stories we hear. Young, healthy marathon runner, et cetera, gets his 3rd shot, all of a sudden he has stage 4 lymphoma.
Wow, that's really scary. Really scary. And you're the enemy for telling people to please take care of themselves, heed the warnings, take the supplements, intermittent fast. You're the enemy for trying to save lives.